Stop. Before you reach for your coffee at 7 a.m., stop. That tiny habitual motion, cup rising to lips, may be putting out a subtle spark you're trying to kindle each morning. The gentle, steady ignition of your thyroid hearth. If you care about steadier mornings, less gut grumbling, and a calmer baseline of energy, hear me for 3 minutes, and then decide whether you'll try a small, precise, week-long experiment. This is not about demonizing coffee. It's about timing. Morning caffeine creates a quick surge, useful sometimes, distracting sometimes, and if you're experimenting with a ritual designed to steady metabolism and calm the gut-thyroid relationship, that surge can compete with the rhythm you want to establish. So the instruction is simple and specific. If you plan to do this ritual, skip coffee at 7 a.m. for the days you're running the protocol. If that sounds reasonable to you, type "I ignited" in the comments right now. That lets me know you'll try the week. No pressure, just a simple commitment to experiment. A quick lineage note. This approach borrows from an ancestral thread of practice popularized in alternative health circles. Think of routines that emphasize digestive clearing followed by gentle endocrine support. One traditional method you'll hear about is a short apple-focused cleanse used like a chimney sweep for the gut. 3 days of simple fruits and hydration to loosen old sticky patterns. I mention that only as context. The apple sequence is optional. Its role, historically, has been to clear the pathway so the daily maintenance ritual can be more felt. We're not presenting this as medical treatment. It's a traditional preparatory practice adapted for modern habit design. Now picture the system metaphorically. Your thyroid sits at the center like a hearth, slow, warming, sustaining the house. The iodine ritual I'll describe is intended to be like lighting the pilot, small, precise, and steady, rather than a roaring flame. The pineal, if you like that language, acts as a subtle regulator, a partner in the rhythm. These are metaphors to help you feel what's happening, not literal claims about curing disease. Keep that in mind as we move into what to do. Materials. Keep them simple and neutral. A clean glass vessel, no plastic contact if you prefer. That's a traditional preference rather than a proven medical necessity. Filtered water at room temperature, and a single-drop iodine preparation described here generically as an atomic iodine or atomodine preparation. Do not use any product you don't trust. If you're pregnant, nursing, have known thyroid disease, or are taking endocrine medications, pause here and consult your healthcare provider before considering anything described. Do not stop prescribed medications to try this. If you have any doubt, speak to a clinician. If you'll proceed, here's the ritual: slow, precise, and deliberate. Pour half a glass of room temperature filtered water into your glass. Add exactly 1 drop of the atomic iodine preparation, no more, no less. Tilt the glass slightly and make a gentle clockwise swirl, no vigorous stirring. Just a soft circular motion to disperse the drop. Hold the glass in your hands if that helps you feel present. Soften your shoulders. Breathe low into your belly. Take up a 2-minute window. For 2 minutes, you will sip rhythmically. 1 small sip every 5 to 8 seconds. Aim for a cadence that feels steady. Quiet inhalation through the nose, a soft diaphragmatic exhale, then a sip. The whole 2 minutes should feel measured, not rushed. Think of it as coaxing warmth back into the hearth rather than lighting a bonfire. Focus on the water moving in the glass, the gentle clockwise swirl, the breath that accompanies each sip. Do this first thing in the morning, before food, and before coffee. That timing is central. The intention is to give the ritual space to settle without immediate caffeine interruption. Schedule. Perform this ritual 5 consecutive mornings, then take 2 mornings off. That 5-on-2-off rhythm allows for integration without overwhelm. If you choose to repeat, you may run additional cycles, but only after observing how you respond. If you opt to include the optional 3-day apple approach as a preparatory chimney sweep, do it with hydration and rest. Think simple, whole apples and plenty of water. That 3-day sequence is optional and meant to clear, metaphorically, the gut, so the pilot light ritual can be more noticeable. Again, optional, traditional, not a medical prescription. Before you try anything, and this is non-negotiable, if you have diagnosed thyroid disease, Hashimoto's, Graves', hypothyroidism, or you are on thyroid or other endocrine medications, pregnant or breastfeeding, consult your healthcare provider. Do not attempt iodine-containing protocols without medical guidance in those states. Stop the practice immediately and seek care if you experience palpitations, sudden flushes, or tremors. Those 3 signals are the protocol's red flags. If they appear, cease and contact your clinician. As you run the 5-day sequence, track 3 simple markers each morning for 7 days total. Bloating on a 0 to 10 scale, 0 meaning none, 10 meaning quite uncomfortable. Energy on a 0-10 scale, and a 1-line note about clarity, how mentally crisp or foggy you feel that day. Keep it concise. A line like steady energy or less bloating is perfect. This data is for you, an objective check on whether the ritual is shifting your baseline. At the end of the week, if you saw a change, share a 1-line result in the comments. Less bloating, or steadier energy, or no change. If you commented earlier with "I ignited," come back and report. A few practical coaching cues to make the ritual more effective. Do it in a calm, uninterrupted moment, standing by the sink or seated at a small table. Notice sensations, the temperature of the water, the way the drop disperses, the rhythm of your breath. Keep shoulders soft and jaw relaxed. If you feel rushed or anxious, postpone. The quality of attention matters. Ritual is partly about precise repetition and partly about cultivating embodied awareness. Important safety framing again, because this is high-stakes territory. Iodine is a biologically active element. The 1-drop wording you heard is part of traditional protocols, but it is not a blanket recommendation for everyone. This guidance is not a substitute for medical advice. If you are under medical care for any endocrine condition, or if you are pregnant or nursing, do not proceed without your provider's approval. Do not alter or stop any prescribed medication. If you note palpitations, sudden facial or body flushing or tremors, stop at once and seek medical attention. These are the immediate stop cues. Take them seriously. If you want to do the optional apple preparatory sequence, keep it simple. 3 days emphasizing apples, hydration, rest, and gentle movement. The aim is modest. More easily moved contents in the gut, less sluggishness. Some traditions suggest a little olive oil at the end of each apple day to help move things along. Consider that only if it aligns with your normal dietary tolerance and after you've checked any contraindications with your provider. Why avoid coffee right at 7 a.m. when you do the ritual? Practically, it's about rhythm and signal clarity. That sharp caffeine spike can mask subtle changes you're trying to notice. It can transiently alter heart rate and subjective energy, making it harder to see whether the ritual is doing anything meaningful. Framing it this way keeps us honest. We're not claiming coffee chemically destroys thyroid tissue, only that the timing of your stimulant can interfere with the calm, measured baseline this practice is designed to cultivate. Experimentation requires control. Skipping that 1 early cup for the week helps create cleaner feedback. If you decide to try this, be methodical about measurement. Record your 3 daily markers for 7 days. Note any symptoms beyond the expected. Unusual sweating, rapid heartbeat, tremor, dizziness, or any other change that concerns you. Report those to your clinician immediately. If at any time you're unsure, stop and consult. At the end of the week, return and leave your 1-line report. If you find less bloating, steadier energy, or clearer thinking, say so. If you notice no change or adverse responses, report that too. Real insight comes from honest tracking, not from wishful thinking. A quick production note you may notice when you watch a demonstration. There will be a short on-screen safety reminder during the ritual clip. That's not theatrics. That's responsible practice. Treat it as part of the process. Visible, clear, and part of the ritual's integrity. To close, remember the central instruction. Stop drinking coffee at 7 a.m. if you intend to give this small ignition ritual room to work. Think of the throat of your morning as a small altar. Clean the chimney if you choose, then light the pilot gently and watch what steady warmth arrives. Sovereignty here means choosing your morning rhythm deliberately, not reflexively. Small, precise actions compound. If you're ready to try the week, type "I ignited" in the comments now. Commit to 5 mornings, track your bloating, energy, and clarity, and return after 7 days with a one-line result. If you found this clear and helpful, like the video and subscribe for more practical, measured experiments that blend tradition, habit design, and modern care. Thanks for listening. Take the next morning with intention and keep your hearth steady.